everyone, Julie here. I'm a physician assistant that works at Gambhir Cosmetic Medicine. I am typically the one that performs the miraDry procedure, and today I just want to go over a consultation with you. The miraDry procedure destroys the sweat glands underneath your arms. You have sweat glands all over your body, and the miraDry only targets the ones underneath your arms. Having those destroyed should not affect the sweating pattern elsewhere on the body. Typically, you only need one procedure, and you're here for about 2.5 to 3 hours. We have you shave 3 to 4 days prior to your procedure. We're looking for you to have some hair stubble in the area so we can use that as a guide to lay down the temporary tattoo and measure your underarm. If you're someone whose hair grows pretty quickly, you can shave the day prior to the procedure. However, we do not want you to shave the day of the procedure because it can increase the risk of infection. Before you come in, we send both a numbing cream that you apply to your underarms 90 minutes prior to the appointment, as well as an antibiotic to your pharmacy, which phone number you would provide us with. The antibiotic you start taking 1 day prior to the procedure and finish out the course after the procedure as well, and that just helps ward off the risk of infection. The numbing cream that you apply topically, again 90 minutes prior to your appointment, is just to make the injected numbing medication a little bit more comfortable for you. Ideally, you're going to want to wear a loose-fitting tank top to the procedure, and for those female patients who want to wear a bra, I recommend wearing something that doesn't ride up into the underarm as well. You can take something like an ibuprofen or Tylenol prior to the procedure to help with the discomfort afterwards as well. Once we have you here for the actual procedure, I clean off the underarms to get that numbing cream off. I'll take a couple pictures of your underarms, which again are just for us, and then I outline that hairline, the stubble basically. I use that as a guide to where to place the pulses as well. Once I have the hairline outlined, I start injecting the numbing medication. It's a series of needles, but most people tolerate it completely fine. It's a mixture of lidocaine and epinephrine. Sometimes the epinephrine, as well as the positioning of your arm like this, can make your fingers feel a little bit tingly, but that typically goes away once the procedure is over. Once I inject the numbing medication, I do a little poke test to make sure that you're in fact nice and numb, and then I measure the underarm. Once the underarm is measured, I apply a temporary tattoo, which kind of tells me the exact places to lay down the pulses during the procedure. I apply a little bit of lubricant, and then we get going laying down the pulses. That part of the procedure is very comfortable for people. Most people feel absolutely nothing. You can feel a little bee sting sensation here and there when the pulses are being placed, though as long as it's tolerable, I let it go. If it becomes super uncomfortable, I can easily push a button to make it nice and cool in that area. I complete one underarm in entirety and then move on to the next, mostly so you're not up like this the entire time because that can be pretty uncomfortable. The number of pulses depends on the size of your underarm, but it can be anywhere from about 20 pulses to about 45. And the length of the pulse also depends on the size of your underarm, but it can be anywhere from about 20 seconds to 30 seconds. Once the pulses are all completed, I ice the underarm and then move on and repeat the same process on the next. After both underarms are completed, I keep you just to ice for about 10 minutes or so, and then you are good to go. The post-treatment instructions for the miraDry are super important. The big 3 things that I tell people is you're going to want to avoid vigorous activity for about 2 weeks after the procedure, especially that first week. We're going to want to make sure that you're not doing any upper body, weightlifting or activity or intense cardio, because that's just going to increase the risk of complication. I usually recommend that you don't do this right before a big event or a big vacation as well. The next big thing is icing around the clock, especially for the first couple days. Usually I tell people ice 20 minutes on and 20 minutes off. If you're driving or you have a desk job, even just keeping an ice pack close by is super important. You can also use ibuprofen around the clock for the first couple days as well to help with the swelling and discomfort. We do provide you with a script for Percocet if you find that you need something a little bit stronger, but most people tolerate the procedure and afterwards with just ibuprofen. We give you a couple stretches that you'd start about 3 to 4 days after the procedure, and that's just to help ward off some complications. Afterwards, you're not going to want to wear tight-fitting clothing or sleeveless tops for about a week or so. The reason is if the clothing is too tight, it can constrict the area and make swelling a little bit worse. And then with sleeveless tops, we really just don't want the skin rubbing up against each other. If you do choose to shave or use deodorant after the procedure, you're going to want to wait about a week or so to do so. Use a brand new deodorant and a brand new razor, again, to help ward off that risk of infection. You're also going to want to finish that course of antibiotics that we provide you. Possible side effects include swelling, bruising, soreness and discomfort in the area, hyperpigmentation, meaning certain areas get darker, hair loss, infection, and ulcers. There's also a possibility of something called tight banding, which happens you feel like you can't quite raise your arm up all the way. We do give you stretches to help prevent that from happening, and if it does happen, you can always just massage the area too. Lumps and bumps under the underarm are very common and will go away with time. And then there's also a risk of altered sensation to the area, which also goes away with time. At the time of scheduling, it is a 50% deposit. You pay the rest whenever you come for the procedure. Depending on when you schedule, we will reach out to you 2 weeks beforehand just to see if you have any questions, as well as to call in that antibiotic and numbing cream to your pharmacy. Of course, if you have any questions or concerns at all, you can email us or give us a call at 610-518-7546. Thanks.